Good day, I'm Trishia Millan, a second-year student nurse from Batangas State University, and today I will be performing the oropharyngeal suctioning. What is oropharyngeal suctioning? Oropharyngeal suctioning is a procedure used to remove secretions from the oral cavity and pharynx. Secretion can block the trachea and obstruct the normal airflow, which can lead to an insufficient oxygen supply. So first, check the doctor's order. So this is to provide a specific care needed by the patient. Now gather all the equipments needed for suctioning. First, we have the suction catheter in an appropriate size, our sterile gloves, our suction machine, and distilled water. So this is to improve time efficiency. Now position the patient or the infant appropriately. So this is to establish proper implementation of the procedure. No. Okay. So after positioning the infant or our client, now we have to test the machine. So turn on the machine to check if the machine is working properly or functioning properly. So if it's needed, regulate it also. So this is to make sure that our machine is working properly or functioning properly. So after checking if our machine is working properly, now we have to wash our hands thoroughly and then put on our sterile gloves. So I already washed my hands and now I will be putting on my sterile gloves. So this is to prevent the transmission of the microorganism. Always remember to be sterile. Now, after putting the sterile gloves, you can now attach the appropriate suction size to the suction tube. So, to have proper sizes, this is to have proper sizes of the catheter to be used in the patients. Now, occlude the suction part using your thumb, like this, and then set it negative to 60, from 60 to 80 mmHg. So this is to prevent trauma to the tissue or this is to prevent trauma and also further complication to the patient. So now before suctioning, estimate the distance or the distance of the catheter to be inserted in the patient. So by doing this, you have to measure the distance of the tip of the nose to the earlobe. So let's do this. So by doing this, always remember that you cannot touch any part of the skin of the patient. So, so this is to provide a proper measurement of the catheter to be inserted. Now after measuring, insert the catheter gently until the measured distance is reached. So remember that you should not apply the suction while inserting the catheter. Okay? So, there. So, after you insert the catheter, now you can, that's when the time you can apply suction. So, there. Apply suction, then slowly rotate the catheter to ensure the proper removal of secretion. So, limit the suctioning limit the suctioning to until till 3 to 5 seconds to prevent trauma to the tissue or the mucosa. So, after suctioning the mouth, you can now do the nasal suctioning. So by doing this, you will put on or insert the catheter backward and upward gently to the nose of the patient. So, So, inserting gently catheter can prevent trauma to the patient's tissue or mucosa. So, after suctioning the other nose, do it on the other nose also. Now, after suctioning, wash the catheter. So, let's wash the catheter. This is the water. And now, so, washing catheter can prevent cross-contamination. So, we have to clear the catheter first before discarding it. So, now discard the catheter. And then after the discarding of the catheter, uh, position the infant again. So, this is to provide comfort for the infant or our patient. Now, discard also your sterile gloves. Then, wash your hands thoroughly. This is to prevent cross-contamination. Then, document the procedure. So, documenting the procedure is for document purposes. So, that's all for our pharyngeal suctioning. Thank you for watching.